Hi, this is Allison Villars. I'm Director of Health and Human Services here in St. Tammany Parish. And we're back with In the Loop, a show that tells you what's going on in the community and gives you information you might need to help other people as well. And we have Dr. Charles Preston, who's our coroner. He's back with us today because he did a summer program regarding water. Well, actually, it's an all-year-long program here, water safety. So if you haven't seen that one, go look for In the Loop on water safety, because we know it saves lives. Anyway, so today we're here to talk about opioids in St. Tammany Parish and in the lives of some of our neighbors. And we're very happy to have you, Dr. Preston. Thanks for coming.
Thank you for asking me. It's a privilege to be here.
Okay, so we know people, have fallen into some opioids, and we know other people have gotten addicted to it because they've been on other drugs and moved into opioids. So can you just tell us first what opioids are?
Well, frankly, opioids cover a large category of medications that are typically thought of as pain medications. Opiates and opioids are all derived from the poppy plant. And so some examples of them would be codeine, hydrocodone, oxycodone, other sort of polymers of those, such as OxyContin, which is a long-acting oxycodone. And then there are the illegal opiates, such as heroin, fentanyl, and all the analogs of fentanyl, acrofentanyl, carfentanil, etc. As you move into that spectrum of the fentanyl and analogs of fentanyl, the potency jumps on the order of thousands to 10,000s. And so it literally becomes a lethal injection. We've had some cases where they've mixed heroin with a fentanyl analog, and we find the person with the needle in their arm. So it is virtually a lethal injection.
Okay, so opioids are legal in one sense.
Correct.
And opioids are illegal in another sense. So let's put the illegal ones aside for a minute. We can come back to them. And talk to me about why is it now that we're hearing all about opioids and this epidemic that's going on across the country?
Well, I think, frankly, it's a relabeling of an epidemic that's been here for a long time, and that epidemic is addiction. And addiction is a disease of the brain that has been around a very, very, very long time. But with the advent of very potent synthetic opiates like OxyContin, that people who have been maintained on prescription medications, and I will say it's a very small percentage of people who are on prescription medications that go on to be addicted to medications. But then when they are addicted and they get cut off from the prescription medications, then their only choice really is to go to illicit drugs and to start and use the illegal drugs. And as I mentioned, there's no FDA for heroin or fentanyl or acrofentanyl, so you never know what you're actually getting in that bag and what you're actually injecting into your system. So it becomes very, 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 very dangerous.
So if I was in great pain based upon having a car accident, say, and a doctor prescribed me after surgery or whatever, putting my bones back together, opioids to take, what am I to think? Or or even before surgery, they would say, go out and buy them and bring them so that you'll have them after the surgery. So how is I, as a person who's not a medical person, supposed to tell the difference of what I'm supposed to do?
Well, I think it's like every medication. If you take it as directed, then the risks, all of the risks associated with the side effects are minimized. It is when people begin to abuse those medications and take them more frequently or at higher doses than are prescribed. And as I mentioned, the percentage of people who become addicted to pain medications that they are using for legitimate medical reason is really very, very small. I have a friend who is very versed in the opiate crisis, and he tells a story of going to a doctor and having an operation, and he was given 90 Percocet pills, and of them he used 3 or 4. So he's a beast of a man. And then he had to have a redo on the operation, and he was given another 90 pills. Well, of course, he at any time could have said to the doctor, hey, I still have 86 from the last time, I don't need another prescription. But the doctor's bias is always going to be to treat your pain so that you're not suffering. And there are a lot of very good medical reasons to do that. If you are suffering, your body is in that hyperacute state, your adrenal glands are secreting adrenaline and cortisol, and your healing process is embarrassed by that. But to kind of get back to this story, he will say, you know, wasn't this terrible, the doctor, to give me 180 pills? Well, I happen to know this guy, and I can tell you that there is zero chance that those pills are ever going to be seen on the street because he's a responsible person and he knows how to keep them away from people who shouldn't get them. And that's part of the message that goes out with folks really for all medications is you have to be responsible. If there are children in the house, you've got to think of them as poisons and keep them very high or keep them in a closet where they can't be reached by children. And opiates have particularly lethal effects on small body mass children, so it's even more important. And then if you get to a point that you've gotten over your operation, your bone is healed, and you find you have 86 pills left, then dispose of them in a safe manner. And generally what the CDC recommends is that you can either take them to an FDA take-back site, or you mix them with kitty litter and grind them up, preferably used kitty litter, I suppose, and then just dispose of them in the garbage.
Okay. So I actually have a colleague who just had knee surgery, and she called me. I called her to check in on her. I said, okay, you know, tell me how it went. And she said, well, I mean, a great deal of pain. And she knew about opioids. She had read all this stuff and seen all these programs on TV and stuff like that. So she didn't take what her doctor prescribed. She took Tylenol, and this was a knee replacement thing. And she said, you know, I didn't listen to people who told me that I should not let the pain get ahead of me. I should stay with, you know, right with it, at least for a while, because it was a week before she took anything, and she realized she had to. So people really do need it.
Yes, they do, and I think that's kind of the backlash of the bad press that opiates are getting, is that we don't get the message out there enough that they are useful medications when used appropriately. And that's a great example, because one of the keys to rehabilitation of a knee surgery is that you get early motion. And you really hit it right on the head. It is much, much easier to maintain a state of being pain-free than to gain a state of being pain-free. For instance, my wife is a retired ear, nose, and throat doctor, and she did tonsillectomies on children and adults, and that's a very, very painful operation, especially for adults. And she would instruct her patients, take this medicine every 6 hours, whether you think you need it or not, because when they would not take it, because it was working, and they'd say, well, I don't really need the pain medicine, they would skip a dose, then they would be so uncomfortable they couldn't swallow their medication, and then they'd return to the hospital for intractable pain and dehydration. So again, it's the best advice is you follow the advice of your doctor and recognize that these medications have been used for many years and that they are safe in general. But we also have to recognize there is a subpopulation of people that are likely to become addicted. And unfortunately, there's no blood test you can do to say this person is at risk and this person is not. So you have to take a really good medical history, see if there's a prior history of substance abuse. And even if there is, that doesn't mean you can't use pain medication. It just means that you may need to take some extra steps of safety, like have somebody else manage the medications, keep the medication, and give it to the person. Just because they have a history of substance abuse doesn't mean that they need to suffer through the pain of broken ribs without the benefit of pain medication.
Okay. So can you move, you said something I think that's really interesting. I need for you to move it a little bit forward. So there are people who are more likely to be addicted than other people? And I know you said there's no blood test for it, there's no test at all for it, but what is that about?
Well, I certainly wish I had that answer for you, because I'd have a Nobel Prize in medicine and be the richest doctor in the United States. It is probably both the nature-nurture argument that there is some genetic component that may lead to addiction, that we know that the children of addicts are at a higher risk of becoming an addict themselves. And then there are probably some environmental factors, particularly when children are young. You know, as a parent of 2 daughters, I always watched my children's friends very carefully, because they tend to run in crowds, you know, and if they're running in a crowd that's experimenting with drugs, then they're likely to experiment as well. If they're running in a crowd that's more interested in getting good ACT scores and into college, then it's less likely to happen. But as I said, I think there's some genetic predisposition that it really may be that once they get that first taste, if you will, that at that point on, the dominoes start to fall. And then our efforts have to be at identifying and treating the disease of addiction.
Well, there's 3 more things that I have on my agenda to talk about, but I also want to make sure that you cover yours. And one of them is doctors prescribing. And when should a doctor, because doctors are out there watching this, hopefully, when should a doctor know that I've had another prescription from another doctor somewhere else?
Well, almost every doctor is going to know that, because now there is a statute in Louisiana that before you prescribe a first-time opiate or pain medication or controlled substance of others as well, that you have to go and check something called the prescription monitoring program. And every controlled substance is entered into the prescription monitoring program, and so as soon as they type your name and date of birth, it's going to show all your previous prescriptions, who prescribed them, and where they were filled. So it's a very useful tool in identifying people who are so-called doctor shopping. I will tell you that in my clinical career, I didn't need the PMP to tell me who was doctor shopping. You could tell by the history that they gave, by the list of allergies that they gave, that they were allergic to all anti-inflammatories and to codeine and hydrocodone and oxycodone, but they could take that medicine, I don't remember, it's Dilaudid. Well, that's a drug that's very, very potent and frequently abused. And so immediately my little spidey hairs would go up on the back of my neck. And generally what I would do is I would go in, run the PMP, and bring it back and say, you know, I see where you've seen 8 other physicians in the last 6 weeks and gotten multiple medications in the class of opiates. Often when we see people like this, there's an issue with substance abuse. Do you think that's your issue, and would you be interested in treatment? And I think that's the appropriate way to manage it, because it is a brain disease, and the underlying disease is addiction. And admittedly, we have seen more overdoses in St. Tammany Parish last year and more involved opiates, but far and away, the #1 substances that we would see are polysubstance drug toxicity. So it would be alcohol and opiates and benzodiazepines and muscle relaxants and this and that. So it's very unusual to see a pure opiate overdose. It is much more common to see it mixed in with a number of other drugs.
And you're moving us on to another topic I wanted to make sure that we covered and talk about. So the people who might be using drugs and might be in a place where they would overdose, let's say that somebody who stumbles upon them and sees them, what should that person, a family member or a best friend, or somebody's coming over, and or that you're walking by a car and you see somebody slumped over and they're still breathing but not much, what should we do?
Like any medical emergency, the first thing to do is to call 911 and activate the EMS system and get people en route to help that person. If it is a pure opiate overdose, and this would apply to families who know that they have an opiate addict in their family, they can buy a drug over the counter now called Narcan, or the generic name is naloxone, and it is a specific antidote for opiates. So it will go to the area in the brain that the opiate attaches to, and it will literally displace that opiate, and so they will regain consciousness and be able to breathe on their own. Again, one of the pitfalls is what we see most of the time through the coroner's office is polysubstance drug toxicity. So the Narcan will work on the opiate component, but it won't do anything for the benzodiazepine, which common examples would be something like Valium or Xanax or other sedative hypnotic drugs. That won't be reversed. Mm-hmm. So that's why I think it's so important that they immediately dial 911. And of course, if they have training in CPR and are comfortable giving artificial ventilation, and if the person's heart stops, then beginning chest compressions as well, mm-hmm. That may be life-saving. Fortunately, in St. Tammany Parish, most first responders, EMS, Sheriff's Office, municipal police departments, the police officers are carrying Narcan. And of course, you know, they get there very, very fast because mm-hmm. there are a lot of police officers covering a smaller area than there are ambulances. So mm-hmm. the police officers and fire departments usually arrive at the scene first.
And people are afraid to give injections and stuff. Is this an injection you're talking about, or is this something different than that?
Actually, Narcan comes as an injectable form, but it also comes as a nasal form. Mm-hmm. And that is really a magnificent drug. You just can't go wrong. It's very, very easy to administer. It comes as a nasal injector, so you put it in the nostril and push the plunger, and it gives the dose. One dose really does fit all. Mm-hmm. The one complication that you may run into is that it could precipitate withdrawal, but it's better to be alive and in withdrawal than dead from respiratory arrest.
And that's why you should, no matter what, try and keep that person around for the EMS people to come
exactly
and take
right.
care of. Okay. So who are the people who are most likely to use opioids incorrectly? Or, I mean, I know people who have an addictive maybe personality or biochemistry, but beyond that, what are we seeing here?
Well, I'd love to tell you that there is some stereotype that you can stand 15 feet away and tell, but you just can't tell. And, you know, again, there's a large population of people that use pain medication appropriately as prescribed and never become addicted. And then there's a small percentage of people that are devastated by substances, whether it's alcohol or stimulants like methamphetamine or cocaine or opiates or a mixture, which is the most common thing. But given the clients that come through the coroner's office, I can tell you that it spans the spectrum of socioeconomic, racial, educational barriers. You know, again, any individual is at risk.
Mm-hmm. Well, I used to work with a nonprofit called, it was a youth service bureau in another state. And one of the things in that nonprofit that we did was we watched youth. Well, actually, we found it out because we, in all the school systems there, did the youth risk behavior study. That is a questionnaire given to, I think, 6th, 8th, sophomores, and seniors across the board. And what we found was startling data on our kids having what they call farm parties, and it's not spelled F-A-R-M, it's P-H-A-R-M parties, where they empty all these low places where medicines are kept, and they put them in a pile in the center of the rug, and they sit around and they all take a handful. So they don't even know what they're taking, and they mix it up. So this is not just an adult issue. This goes into kids using as well.
Absolutely.
So besides putting things high, how would I know if I had a child, even a middle schooler we were finding out, or a high schooler, or a college kid coming back? What am I going to see in those children that might make a difference to me and me able to intercede?
Well, I think the one word answer is change. If you see a change in your child, a change in their behavior, a change in their sleeping habits, a change in their grades, which are usually not getting better and better, they're usually getting worse and worse. And again, a change in friends. You know, if you start to notice that your child is breaking curfew, staying out late, that you can't locate them, that they're beginning to seem like they're evasive, they're not trying to answer your question, then frankly the best possible thing you can do is sit down, reassure that child that you're coming from a place of love and that you're concerned about them, and have a frank conversation with them about the behaviors that they may be involved in. And you know, frequently children will say, well, that's not me, that's just my friend. And you can say, well, you know, your friend is at risk of dying from an overdose, and particularly, you described exactly with these farm parties, and I know exactly what you're talking about. It is just disaster waiting to happen, because it's not just the opiates, but they're throwing in blood pressure medications, cardiac medications, all kinds of different medications that can have very dangerous interactions. And so I think the surprising thing to me is that anybody ever survives one of those parties, not that there's a death from one. That seems more likely. But again, I think the issue is if you identify a change in behavior, a change in grades, a change in friend group, just a change, then it's time to sit down and have a heart-to-heart, life and death talk with your child, just like you would have a talk with them if they were diagnosed with diabetes or a pediatric cancer, because it may be the difference between life and death. And I've said this many times before, there is no greater tragedy than a child predeceasing a parent. And so you don't want to be standing over a coffin saying, if only I had. So before you're in that position, you want to do it. You want to have that tough talk. And it doesn't always go well. It doesn't always go well, but you've got to try.
And maybe have to have it multiple times.
Maybe have to have it multiple times.
Or intercede and take them straight to somebody who could tell more than you, or talk to them differently.
Well, certainly I think if you have a high enough level of suspicion, you've got to keep in mind that it is a medical problem. And frankly, I think particularly with substance abuse issues, it needs a multifactorial treatment. It needs medication-assisted treatment to deal with the physical effects of the addiction, and then it also needs talk therapy, cognitive behavioral therapy, or some form of talk therapy. And it likely will require several different providers. So you may see a psychiatrist that manages the medication, and see a psychologist that manages some of the talk therapy, and then the strength of peers. And I think that's a very important thing, is peer-to-peer counseling, where somebody can say, look, I was where you are right now, and this light came on, and this is what saved my life. And I think, you know, particularly I'd have to mention NAMI St. Tammany, the National Alliance for Mental Illness here in St. Tammany, is an excellent resource and has a lot of different resources available for both people that are suffering from addiction and for the family members that are loving the people who are suffering from addiction.
So besides NAMI, if my son or daughter said, yes, Mom, I'm using, but I can't get off of it because I've watched people in withdrawal before, where am I going to take them? I mean, besides calling NAMI, they would tell me where to take them?
They can probably give you some resources. Again, I don't want to speak for another agency, but I would imagine, you know, the first step for most people is going to be your family doctor, your pediatrician. And the pediatrician may not themselves administer the medically assisted treatment, but they may be able to move you in the direction of a provider who has. Now, I will tell you that there's a big motion right now to get primary care doctors to buy into medically assisted treatment, both for children and adults, because frankly, we just don't have that many psychiatrists. And there are only so many hours in the day, and virtually every psychiatrist I know is very, very busy. And so they're a precious resource. And so they often have to rely on primary care doctors or pediatricians to at least do the maintenance of medications. Although I think that, depending on the level of their disease process, they may require the intervention of a psychiatrist. I suppose the analogy is a family doctor can manage your high blood pressure, but when you're having a heart attack, you need the cardiologist.
Okay.
So, if there are not in life-threatening behaviors, then it may be the pediatrician or family practice doctor can network with a mental health professional to get all of the resources that the person needs. Unfortunately, there's not one place right now that you can go and get all of those needs met. Of course, we're very optimistic that the Safe Haven Project is going to create that environment where people not just having issues with substances, but also with psychiatric issues, will be able to go, be evaluated, get some crisis respite treatment, go through a sobering center, get plugged into outpatient treatment. But it really is, I think this is the case, sort of the old adage, you can lead a horse to water. Mm-hmm. So you can bring an addict to treatment, but if they're not in the mindset that they recognize their own disease process and want to have buy-in to their treatment, you just can't force someone to use good judgment.
Mm-hmm. Well, I know Safe Haven is going to be a real addition to the community, and that you, in your role, have been working diligently on behalf of all of the people in St. Tammany Parish to help make that come forward, and we're looking forward to it. So if I had a child, I could bring him to Safe Haven, they would evaluate that child?
Well, at least the model for now, and I would have to say I've had a tiny little role in Safe Haven. There are a lot of people who have done a lot of hard work. I am just one cog in a very large wheel. Mm-hmm. Initially, at least, the model is to try to take adults and not children.
To start with.
Mm-hmm. Now, hopefully, as it becomes more established and self-sufficient and resources will be able to expand, that they'll be able to add children as well. But I think initially the program is designed to deal with adults.
Okay. Well, I'm real happy that you've been able to be with us today. I wish there were even more time, because I wanted to ask one more thing. And what does law enforcement do besides, give Narcan if necessary on the site? Do they lock people up, or do they do something else?
Well, I think that that's a very important question, and right now Sheriff Smith is developing what's called the Crisis Intervention Teams, the CIT teams. He has managed to get a Bureau of Justice Administration Valor grant to train additional CIT people. That work is literally happening right now, and in December they will be holding a 40-hour training period for additional deputies. And the hope is that people that are really having a mental health or substance abuse problem will be recognized as a medical problem and taken to, for the moment, a hospital, but someplace where they can have medical intervention. Obviously, if they're breaking the law, then they're going to be taken into custody. I would have to mention the Project Angel that Tim Lentz started in Covington, and now all law enforcement has bought into, that if an addict comes into a police station and says, I want help, then they will help to get that person to a facility or a caregiver to help initiate treatment for their disease process. It's not ideal, but it is certainly better than nothing right now.
And better than getting locked up and not having treatment available at that time.
Absolutely.
Well, Dr. Preston, you've been great to join us a second time to help our population understand what's going on in our community and give them some ideas about how they might handle it if it impacts them directly. So this is Allison Villars, and I'm with Dr. Charles Preston, and we are here finalizing the In the Loop on opioids. I hope that you will refer your friends to this show if they didn't get to see it, in case they need this information.